Hi, it's Dr. Joe Markovich, the anti-aging doctor. I want to tell you a little bit about the whiplash accident and a chiropractic neck adjustment. Well, your normal curve is normally like this. This is your cervical spine. This is your head sitting here. You're facing this way. So this is the front of you, and this is the back of you. Those bumps you feel in your back, well, those are those bumps right here. Those are called the spinous processes. And there's a ligament that goes along here. When you get in a whiplash accident, what happens is the momentum of the accident causes your head to whip because that's the smallest part that's not tied in. I mean, they don't have your head strapped in. They strap in these guys that are going 200 miles an hour now with the NASCAR because their heads get ripped after Earnhardt died. These things get ripped in an accident, and what happens is this ligament gets torn when it goes forward, and if you have a really bad accident, it gets ripped in the front. There's a ligament in the front that tears and it goes back, so you have this internal bleeding in here and all this stuff. And generally what happens is you lose this curve here. You lose this curve, and that's what chiropractors work with. These bones are misalignment, putting pressure on the nerves. People have headaches, terrible problems with their back, terrible problems with their shoulders, eye problems, pain behind the eyes, difficulty in swallowing. I mean, you name it, dizziness. All these things can come from these pinched nerves because all these nerves are controlled by the brain and the spinal cord, and they get pinched off in here through the accident and cause all this trauma and bleeding and swelling in there. And the medical approach is we give you drugs. Well, the chiropractic approach is you don't need drugs, you need your body's ability to let your body heal. And what we do is we move these bones, and generally just laterally. Now, if some chiropractors want to twist this. This is not what you're supposed to do. You go in and you move the bones just laterally because they move laterally, and that's the best way on it. That's what we learned at Palmer School. All right, the lateral neck adjustment is the best adjustment. It's like a Gonstead adjustment or a toggle type adjustment. All of these things are just unidirectional. They just kind of go one way. They're not twisting and rotating. You don't need to twist and rotate. I've gotten these twist and rotate. I've had the worst neck because I've done all these sports and accidents and all. The worst neck. If I get that twisting motion adjustment, and I know when I get them, I don't go back because that just really hurts me. I just feel really lousy after that. I get headaches and I just don't feel good. Just lateral adjustments, and it's very simple to do, but it ain't easy. It's just like anything. You have to get an expert, someone who's been doing it for years. I've been doing it for 30 years. Am I good at it? I'm getting good at it. It takes about 30 years to get good. And all these kids come straight out of school like, yeah, I think I know. Well, it's not so much what you can do, is what to do and when not to do it. So that's really the key to chiropractic, to know what to do, have the ability to do it, but to know when to do it and when not to do it. So the spinal and these adjustments for these whiplashes really are beneficial. Help these people so much. It's helped me so much. I've had so many damn accidents. It's crazy. And I'm convinced that without chiropractic, I wouldn't be here today. So I do this for other people. I'll do this with my last breath. People say, oh, yeah, you're full of crap. Yeah, well, maybe I'm full of crap, but I'll adjust people with my last breath. And I hope that's a long time from now, 100 years or so, but maybe not that long. We'll see. And but these adjustments, they really help the body heal. And then you've got to try to strengthen this back here to get those muscles to hold. That's why we do these therapies that we have. You get the muscles to hold because the ligament is torn. It's like if you tore your ligament in your knee, your cruciate ligament, you can't really get that thing strengthened up, but you can strengthen the muscles around it. That's what you do with the neck. You strengthen that neck. That's why you see so many of these guys, these football players, have these huge necks. Sure, they've torn their curve, torn their ligament, but they get the strong neck that can support that, and they bull their neck. That's where your strength is. So that's all I have to tell you for today, but get your chiropractic adjustments, your neck adjustments, which you have whiplash, and it can help you with all your problems. Have a great one. Dr. Joe.